I'm going to talk about the interventional treatment of sacroiliac joint, which has, I think, been something that we are more and more becoming familiar with and in tune with because of the clinical need in regards to taking care of our patients. The sacroiliac joint, as you know, is it's a synovial joint. It has a capsule, it has a synovium, and opposing articular surfaces of the ilium and the sacrum, and it dissipates the forces that are transmitted from the spine into the lower extremities. It moves a little bit, 3 degrees or so of flexion extension, about 1.5 degrees of axial rotation, and about 1 degree of lateral bending. It is implicated as the source of pain in some 15 to perhaps up to 30% of patients with chronic low back pain. Now, in patients that have had previous lumbar fusion, that number goes up even higher, perhaps as high as 40% or greater.